Okay, thanks. Well, after that performance and the introduction, I think we can all go home already. So, okay, Roger, you get a bit more for your bonus this year. Okay, so Minister of State, Ministry of Digital Development and Information and Ministry of Health, Ms. Rahayu Mazam, NUS President, Professor Tan Eng Chai, Chairman of the Lien Foundation, Mr. Lawrence Lien, Chairman of the NUS Medical International Council, Mr. Kishore Mahbubani, distinguished guests, colleagues, students, ladies and gentlemen, I would like to express my sincere appreciation to all of you for taking time to come to this lecture. It is the convention that professorial lectures begin with the professors talking about how they got started in research. But because we have limited time, I'll skip that and just leave you with a photo of myself when I first graduated almost 40 years ago and get straight to the point. In my lecture, I'll highlight three main points. That of going beyond academic publications to practice and policy, going beyond public funding to public-private partnerships, and going beyond promoting health to optimizing human potential. In 1991, Singapore launched the first 5-year science and technology plan. The Singapore government invests about 1% of Singapore's GDP regularly in these plans, which are refreshed every 5 years and designed to support Singapore in becoming an innovation-driven, knowledge-based economy. In 2011, the Science and Technology Plan was renamed the Research, Innovation and Enterprise Plan and was organized along 4 strategic domains. 1, advanced manufacturing and engineering. 2, health and biomedical sciences. 3, urban solutions and sustainability. And 4, services and digital economy. But in 2016, the health and biomedical sciences domain was renamed the Health and Human Potential domain, signaling Singapore's government's focus on her most important and only natural resource, human capital. The focus on enhancing human potential, especially early brain development and behaviors, was emphasized by our then Deputy Prime Minister, Mr. Heng Swee Keat, in Parliament in 2020. What do I mean when I say human potential? It is the set of intrinsic health and abilities that an individual is conceived with, that is influenced by biological, environmental, and socio-economic factors throughout their lives. Our aim is to help all individuals get the best start to life and to develop optimally throughout their life course. The main natural resource Singapore has is her people, and we must optimize their potential. This is best done as early as possible when the biology of the individual is still plastic and the effects of early intervention are most effective. Especially for the human brain, where much of the critical social emotional skills, habits, and executive functions are developed and set in the preschool years, especially before the age of 4 years. Trying to change these after children start formal schooling at the age of 7 years requires a lot more effort and may be less effective. You will see evidence of this later in this lecture. Executive functions include the ability to sustain attention, process information, and regulate emotional states, all of which are essential for learning and school performance. In fact, executive functions are probably more important than IQ in determining success in life. From the Dunedin study that's been following children in New Zealand since 1972, they found that childhood self-control promoted various aspects of physical, mental, and social well-being. On the other hand, having poor executive functions or self-control in childhood is predictive of poor outcomes in adulthood. Many children with poor self-control grow up to be adult smokers, criminals, and live on welfare. So of the 4 predictive risk factors for poor outcomes, I suggest that low self-control or executive functions is probably the only factor that we can modify easily, and we should do our best to improve them. Using data from a Dunedin study, it's estimated that adults with poor executive functions may earn more than $1 million less over their lifetime, have 66% less in savings, and may be 3 times more likely to be financially dependent on family or public subsidies. So optimizing the executive functions of children in Singapore has become the main mission of my colleagues and myself. If we want healthy, successful adults, we have to start when they are young. And this is what Singapore's former Prime Minister and current Senior Minister, Mr. Lee Hsien Loong, spoke about at the National Day rally in 2017. For the first time, he officially outlined the importance of the preschool years in giving children a good start and the best chance to succeed in life. Immediately following his speech, Singapore's Ministry of Education announced the opening of ministry-operated kindergartens starting in 2019. Prior to this, kindergartens were mainly run by philanthropic organizations, NGOs, and private operators. And in October 2022, Singapore announced the creation of more government-backed infant care, childcare, and nursery facilities for children 0 to 5 years old. This importance of investing in early child development was again re-emphasized by our then Finance Minister and current Prime Minister, Mr. Lawrence Wong, in April 2022. So you can clearly see our national focus and emphasis on developing and optimizing our human capacity and potential. So now let me tell you about a study I've been involved in for the last 16 years. The Growing Up in Singapore Towards Healthy Outcomes, or GUSTO study, was launched in 2009 and recruited over 1,200 mothers in Singapore in the first trimester of pregnancy. We've been following these mothers, children, and their families very closely since then. The oldest children turn 16 years of age this month and are probably the most intensively studied teenagers in the world. The striking thing about the GUSTO study is the depth, breadth, and longitudinal nature of the phenotyping and biological measures made. For example, in the first 2 years of life, these children and families were studied 11 times through home and clinic visits. We collected the DNA, microbiome, and blood of the mothers and babies, performed EEG studies on the first day of life, and whole body MRIs at 1 week, which were then repeated roughly every 2 years from the age of 4 onwards. Detailed neurodevelopmental, body composition, and cardiometabolic studies were conducted regularly as they grew up, and in their teenage years, we are now focusing more on their social behaviors and connections. While we have delivered the usual academic outputs, what we are most proud of are how our findings have influenced practice and policy to optimize human potential in Singapore. Because the GUSTO studies are already contextualized to the Singapore setting, our government has been very ready to turn some of GUSTO's findings and insights into interventions to be implemented and evaluated in our population, especially if the findings reflect earlier findings of other researchers or are replicated by other cohorts. And where possible, we pilot these interventions before full-scale implementation. The Center for Holistic Initiatives for Learning and Development, or CHILD, was set up by a generous donation of $30 million by the Lien Foundation to draw on GUSTO data and the evidence from other studies to implement evidence-based innovation in early childhood development. It bridges evidence and policy by engaging policymakers from various governmental agencies to help translate our science into community interventions. So, Ms. Rahayu Mazam is the chair of our policy advisory committee. And she's made a lot of effort and given a lot of time to helping our cause. And this is a good example of PPP, or public-private partnerships, between professors, philanthropists, and policymakers. Bringing science or evidence into practice is not a simple or straightforward process. It requires us to identify the challenges and gaps that exist locally, recognize who we are trying to help, design appropriate interventions that we implement carefully and evaluate rigorously, and then refining the intervention until it works. And even then, there's still further need to reevaluate and improve further. So it is a very much an iterative process. It is estimated that evidence takes on average 17 years to be incorporated into routine practice successfully. To speed this up, we need close transdisciplinary partnerships among health scientists, social workers, and many others to implement and evaluate interventions in the community before committing to them and scaling up. Sangcare SG is a charity that I chair with strong ties to the community that allows us to engage deeply with the community to pilot and evaluate our interventions before handing them over to government agencies for consideration to scale up. As a charity, Sangcare SG is able to act quickly and responsively to deploy resources for community needs and take risks where governments can't. So this is another advantage of the PPP between professors, philanthropists, and policymakers. So let me start with the first key finding of Gusto that had an influence on Singapore policy. When I was training as a student and resident, I was always taught that the incidence of gestational diabetes in Singapore was less than 10%. And the best way to pick it up was to only test women with risk factors. But in a Gusto study, we screened everyone with an oral glucose tolerance test and found that the prevalence of gestational diabetes to be nearer 20%. So using the high-risk screening approach, we were routinely missing half the mothers with gestational diabetes, which we reported in this publication. But what was really striking was the fact that 44% of the mothers with gestational diabetes in our study became either pre-diabetic or diabetic within 6 years of their original diagnosis of gestational diabetes. By testing only women with risk factors, we were missing the opportunity to intervene to prevent mothers with gestational diabetes from progressing to diabetes later on. And for people with pre-diabetes or with risk factors, if we do lifestyle modifications, we can reduce their chance of developing type 2 diabetes by almost 60%. So we are missing the opportunity to do this when we were doing the old high-risk screening method. So let me go through the sequence of events in detail. So in 2014, Singapore's Ministry of Health practice guidelines recommended testing for GDM only in mothers with risk factors. Our publication showed that by doing this, we were missing half the mothers with GDM. We presented this to Ministry of Health in September 2015, and to MOH's credit, it took them less than 3 years to come up with new guidelines recommending that all pregnant women be tested for GDM. This was 6 years before the US made the same recommendations. When we published our article in 2021 about how 44% of women with GDM went on to develop pre-diabetes or diabetes within 6 years, MOH again responded very quickly for a new guideline that recommended regular testing for diabetes for life in women who previously had gestational diabetes. This example highlights how the Singapore policymakers take the findings of researchers very seriously and are not only willing to turn research into policy, but to follow up and revise these policies as new findings emerge. I will now highlight some examples of how we use the highlights from the Gusto study to optimize human potential in our population. And I'll start off with the idea of early screening for school readiness. We developed a whole child panel in Gusto to assess pre-academic skills as well as behavioral and social emotional functioning in children, and performed it on the Gusto children at 4 years of age in their homes. This is a test that can now be completed in about 15 minutes using an iPad. This test was developed by Dr. Evelyn Law in that photo there. We found that the whole child panel could predict at the age of 4 years the children who require special learning support when they entered school at 7 years of age. So when you enter primary 1, the Ministry of Education systematically screens all the children, and those who don't do well for reading or mathematical abilities have to go to special learning support classes. The sad thing is that most of them who enter those classes never quite graduate from those classes. They will be always stuck in that sort of the fringe there. And that's because a lot of their abilities have already been sort of set by the time they're age 7. This prediction had a 93% sensitivity and 86% specificity. Good, but probably needs to be refined further before wide implementation. We found that pre-academic skills alone, which is what most people test at age 4, at most explain 1/3 of the variance in the need for special learning support at age 7. In contrast, family demographics, health, and pregnancy and preschool executive functions especially contribute 50 to 70% of this risk prediction. So at age 9 years, 100% of the at-risk children, defined as those whose scores on the whole child panel were 1.5 standard deviations below the mean, performed poorly for reading in a Wechsler individual achievement test done at 9 years of age. You can see in the graph that although the scores varied, none of them actually approached the mean. The odds ratio of children at risk, based on the whole child panel, at 4 years of age failing their reading test at 9 years of age was 17.62. This is probably one of the largest odds ratios I've seen in any studies, clinical studies I've personally conducted. And the odds ratio of children at risk of failing their math test was even higher, 18.12. So the Ministry of Education wanted to try this out in real life, and we completed piloting the whole child panel with the Ministry of Education in about 350 4-year-old children in MOE kindergartens, with testing to see if self-regulation activities led by teachers in classrooms can improve executive functions. So the whole child panel, as I mentioned earlier, is easy to administer on a tablet in about 15 minutes or less with minimal teacher training. The executive function playbook devised by Dr. Evelyn Law's team provides a set of classroom activities that can be easily incorporated into the kindergarten curriculum. Using the executive function playbook activities during kindergarten 1, with an average dosage of 44 minutes per week for 8 weeks, resulted in significant improvements in cognitive flexibility compared to controls. Cognitive flexibility is one of the 3 skills of executive functions, which is crucial for creativity, problem solving, and resilience. Intervention before age 5 years showed more improvement than after, and the improvements were more prominent in typically developing children or those with mild executive function deficits. When the deficits were too much, then the improvement is not significant. We are also working with the Early Childhood Development Agency, the Ministry for Social and Family Development, the PAP Community Foundation, and NTUC to further develop and deploy the whole child panel in their preschools. The latest update is that we have tested over 2,000 children in different anchor-operated and MOE kindergartens. We've also built an app that is being currently tested in 3.5 to 7-year-old children in nursery schools and in kindergartens, and we are still evaluating the results. The whole child panel was mentioned by then Deputy Prime Minister Lawrence Wong 2 years ago. It's a tool that helps teachers to better evaluate children's language skills, social perception, and other abilities, and has been rolled out at 18 preschools run by the PAP Community Foundation. So, and the whole child panel is the preferred tool used by ECD and MOE for this purpose. Okay, so that was screening for school readiness. Another way early screening can help is with maternal emotional health. We can easily screen for symptoms of perinatal depression in women using the Edinburgh Postnatal Depression Scale. In Gusto, we did this during pregnancy in the 2nd trimester, as well as after delivery. As expected, about 10% of mothers in Gusto had probable clinical depression, with a score of 15 and above. But what was less expected was that another 30% had high levels of subclinical depression. So that's 40% of mothers in Gusto experiencing high levels of depression. So it's basically a real population health issues. And I'll let you know what the implications are in a short while. As I mentioned earlier, we perform a whole body MRI on the Gusto babies at 1 week of life. This way we know that findings in the babies were probably due to pregnancy and not postnatal conditions. We are particularly interested in the neurodevelopment of the babies and perform these scans of the brain at 1 week, 4.5 years, 6 years, 8 years, 10 years, and now 14 years of life. This has resulted in many publications over the years. One of our earliest findings was published in Biological Psychiatry in 2013, where we found that high levels of depressive symptoms in the mothers during pregnancy was associated with microstructural changes in the right amygdala of the newborns at 1 week of life. So the right amygdala is the part of the brain that processes negative emotions, suggesting the possibility of transmission of vulnerability for mood anxiety disorders from mother to child. And these findings persisted when we repeated the MRIs subsequently. This landmark publication in the American Journal of Psychiatry in 2015 showed how the association of maternal anxiety with the thicknesses of the parietal and prefrontal cortices of the newborn babies was modulated by their COMT or catechomethyltransferase gene haplotypes, lending biological plausibility to the association. The COMT gene controls enzyme activity that metabolizes stress hormones that regulate functions like personality, planning, emotion, and working memory in the children. But so far, these are only associations between maternal emotional health and MRI findings. Are there any functional consequences for these children? Yes, there are. At 4 years of life, when we administered a whole child panel, which measures school readiness, as I mentioned earlier, children of mothers with both subclinical and clinical levels of depression perform significantly worse than children of mothers with low levels of depressive symptoms. The difference in performance being about 1 standard deviation for behavior and social emotional problems, general knowledge, fluid reasoning, and executive functions. So you may well ask how maternal mood during pregnancy can affect the child's neurodevelopment and subsequent performance. The framework shown here is conceptual, but we have shown that maternal stress is associated with alterations in the baby's brains on MRI as early as 1 week of age, and that it persists in later years. Stress experienced by the mother during pregnancy is transmitted to the baby through the stress hormones, and it's a form of very early life adversity for the baby, and may result in accelerated maturation of the baby's brain regions like the reward networks, and impact subsequent child behavioral outcomes like executive functions. We have confirmed this finding in several major publications. So because of our great concern about the effect of maternal mental health during pregnancy, this was the first evidence insight we issued from Child in April 2021, explaining why women should be screened and supported for emotional distress before, during, and after pregnancy. This is now routinely practiced in NUH and KKH, and probably SGH as well, and we're working on ways to scale it across the private hospitals. The shortage of clinical psychologists is a slight barrier to implementing this at a national level. And now we move on to screen time. We have found in our EEG studies in Gusto that infants and toddlers exposed to more than 1 hour of screen time per day develop EEG patterns similar to children with attention deficits. We are already noting significant differences in brain microstructures and connections in MRI views of the child's brain at age 6, particularly affecting the reward network. So decreased functional connectivity within the reward network suggests poorer cognitive control in reward-based decision-making, and this may affect inhibitory control and drive behaviors like addiction. But these are, again, EEG and MRI findings. Are there any effects on function? Again, the answer is yes. Every 1 hour extra of TV viewing time in infancy, so below 12 months of age, or below 18 months of age, is associated with minus 1.55 IQ points for the child at 4.5 years of age. So the odds of having an IQ score of less than 70, which is the threshold for intellectual disability, was 6 times higher among children who watch more than 1 hour per day of TV. But fortunately, I survived. So we issued the second child, I think I did. Have to ask my wife. We issued the second child evidence insight in July 2021, recommending that infants and toddlers below the age of 18 months get no screen time at all. This recommendation was quickly adopted by the Singapore Health Promotion Board and rolled out through various channels to parents and childcare teachers. These are some newspaper reports at the end of January 2023, featuring the findings of a major gastro publication on the effects of screen time in infancy on cognitive function later in school. Importantly, more exposure to screen time below the age of 12 months was associated with poorer executive functions at 9 years of age, showing the long-term real-life consequences of early childcare practices. Singapore's policymakers were again very quick to respond, with the Ministry of Health issuing their first ever parental advisory on screen use in children in March 2023. Again, the Ministry of Health reviewed further evidence from our studies as well as others and revised their advisory earlier this year with more specific advice for parents. Let's look at another example, that of maternal sensitivity or parental sensitivity, which in Gusto we define as the caregiving attributes of a mother to appropriately perceive, communicate, and respond to her young child's signals. In Gusto, maternal sensitivity was measured through video coding of a 15-minute mother-child interaction. Children of sensitive parents are better able to develop strong self-identity, self-control, and social skills. Greater parental sensitivity regulates and tempers a child's fear response, influencing subsequent responses to anxiety-inducing in situations. So besides measuring maternal sensitivity at 6 months of age using video recordings, we also performed a frustration test at 3 years of age, where we very meanly gave the child a toy in a lockbox with keys that didn't work. This, of course, frustrated the children, and the 3-year-olds demonstrated better recovery from frustration with mothers who displayed greater sensitivity after the frustration task was completed. Greater maternal sensitivity has positive effects on a child that goes well beyond early childhood to improve school readiness at 4 years of age and academic performance at 9 years. So better maternal sensitivity when a child is 6 months old is associated with better mathematical and reading abilities when a child is 9 years of age. I mean, that's quite amazing, but it's still an association. We need to do the studies to prove causation. So this article was published in October last year. What shocked me was that 26.5% of the children in Gusto reported high levels of depressive symptoms at 8 to 10 years of age. That's quite amazing. Over 25% at age to 10 years of age having high depressive symptoms. But the positive thing is that Gusto findings suggest that improving executive function skills may prevent depression and other mental health issues in children at risk. So beyond better school readiness and performance, a good early home environment where sensitive parenting is practiced will promote better executive functions in children that can be protective against risks for childhood depression and other mental health issues. If you remember, I mentioned earlier that better cognitive flexibility, one of the key components of executive functions, leads to better creativity, problem solving, and resilience. So play between a caregiver and child in these early years lays the foundation for healthy child growth and development. Early play interactions affect the development of a child's brain, social skills, language skills, emotional development, and executive functions. So research in Singapore shows that a caregiver's sensitivity and positive emotions during early play interactions are beneficial for child development, and evidence for these findings are laid out in these 2 evidence insights from Child issued in 2023. And we've moved on from there. The Let's Play program that Sankey SG developed jointly with Child that has been funded by the Temasek Foundation. It's another good example of a public-private partnership. It builds on the evidence that we have gleaned from the studies in Gusto around sensitive caregiving. Let's Play is a family-centered approach to support the social, emotional, and cognitive development of young children by empowering grandparents and other caregivers to form safe, stable, nurturing relationships with the children they are caring for. One of the most essential experiences in shaping the architecture of the developing brain is the serve and return interaction between children and significant adults in their lives. Young children naturally reach out for interaction through babbling, facial expressions, and gestures, and adults should respond appropriately and sensitively to this. This back and forth process is fundamental to the wiring of the brain, especially in the earliest years. This serve and return interaction may come naturally to some adults, but others, especially Asians, may find it awkward and difficult or even dismiss it as indulgent and unnecessary. So it's important that we educate carers of young children about the critical importance of these interactions. Let's Care is another training program, this time for migrant domestic helpers, co-caring for young children under 6 years of age, conducted by early childhood experts from Child and co-organized by Sankey SG and the Bahani Han Center in partnership with Temasek Foundation. It involves 6 3-hour training sessions conducted on Sundays twice per month, where participants will receive instruction on child health and development, training in caregiving best practices, and given opportunities to practice strategies to address challenging caregiving scenarios and have expert-led interactive sessions. These are some feedback from the foreign domestic helper participants. Generally, it's been positive, not only from the migrant helpers, but also the employers. So our hope is that Let's Play and Let's Care will lead to better caregiving of young children in Singapore by grandparents and domestic helpers if they are skilled up eventually. But first, we have to refine the programs and evaluate them rigorously to ensure that they have the desired impact and that these effects are durable. The last example I will talk about is early eating behaviors. As in many places, child obesity in Singapore is rising. In Gusto, we observed and measure eating behaviors in 4.5 and 6-year-old children by videotaping them in our eating laboratories. What we found was that 3 early eating behaviors were associated with higher adiposity or overweight in children. They were 1, eating speed. The faster children ate, the more calories they consumed, and this habit picked up at 4.5 years of age, persisted at 6 years of age, and was associated with higher BMIs. So one way of reducing eating speed is maybe banning devices from the dining table and encouraging conversations. So that was just slow down the whole process of eating and the meals. 2, portion sizes. If they serve themselves larger portion sizes, they also had higher BMIs. And we know Asian parents, we like to load the plate and then insist that the children finish everything, right? So maybe not such a good thing, even though it's done with good intentions. And eating in the absence of hunger or snacking. If children were tempted by snacks even after eating their fill, they also are prone to overweight. This is part of the impulse control issue that again shows that executive functions are important. So we feel that all these 3 eating behaviors are modifiable if we act early enough. This publication is one of my favorites. We studied how risk factors for child obesity like overweight, parents, mothers with excessive gestational weight gain, and high fasting plasma glucose were associated with skin fold measures in children at 6 years of age. What we found was that regardless of the number of risk factors, children do not become overweight unless they had the bad eating behaviors I just mentioned. So the common pathway for child adiposity is through how they eat. Children don't get fat just by having risk factors. They have to eat in a wrong way. So while we cannot modify the genes or parents of children, we can try to modify the early eating behaviors. So another of our child evidence insights focus on eating behaviors in childhood, and I'm happy to say that the Singapore Health Promotion Board, as well as the childcare sector, are taking the findings seriously. We have started pilot studies in preschools involving children 3 to 6 years of age to see if we can modify their eating habits. This is the Appetite Toolbox, developed by Dr. Kerry McCricket, that has been piloted on over 300 preschool children locally. The appetite knowledge in these preschool children improved significantly in the intervention groups. The educators reported that the children increased the extent to which they would report how hungry or full they felt before and after meals. After the pilot, children, particularly youngest, became more accurate at identifying changes in hunger, fullness, and all the educators said they would continue to use the Appetite Toolbox. So while we have proved that the Appetite Toolbox is acceptable to preschool teachers and children, and thus improve the children's appetite knowledge, there's still quite a lot of work to do before we can scale this up as an intervention. Finally, I hope you've enjoyed hearing about the research insights from Gusto. To bring all the science we have uncovered so far to the public, we are launching this guide to growing up in Singapore towards healthy outcomes soon, in the next month or so. And in the usual fashion of the NUS Yong School of Medicine, it will be beautifully illustrated. So in summary, I hope my presentation has highlighted how we can take the next step in going beyond academia to bring our science into practice and policy. The data collected by Gusto identified gaps and opportunities for us to improve the health and human potential of Singaporeans at key points across the life course. Opportunities identified include maternal emotional health, early screening, screen time, caregiving, sensitivity, and early eating behaviors. We are taking these opportunities to give our children the best start to life with the help of strong public-private partnerships. Research cannot be translated into interventions and policies that will benefit communities without professors going beyond publication, philanthropists' support to pilot interventions, and policymakers adopting and scaling up interventions that work. We need to work together and go beyond to give our children the best start to life. After all, as Jackie Kennedy said, if you mess up your children, nothing else you do really matters. Thank you.